Welcome back, class. This is Unit 11. Part of it is the circulatory system, which is Chapter 19 in your textbook. The circulatory system is made up of the heart, the blood vessels, and blood. The heart is a muscle. It has three layers: the pericardium, the myocardium, and the endocardium. And the main function of the heart is to pump blood. Peri is what is around the outside of the heart. Myo is the actual heart muscle, and endo is the inside lining of the heart. Those are the three layers again. There are four chambers of the heart. There's a right atrium, a right ventricle, a left atrium, and a left ventricle. Functions of the heart: it pumps blood throughout the blood vessels to every cell in the human body. There are two phases of the heart: systole and diastole. Systole is when the ventricles or the lower chambers contract, and diastole is when the ventricles relax and fill with blood, or the relaxation phase. And there's a separate video for you to watch. It's just a 2-minute video on the flow of heart and the function of the heart, and that's what that YouTube link is there, and it's in a separate location. But basically, the flow of the blood of the heart, you can see the little shadow of the lungs on the right and the little shadow of the heart on the right there. The blue side is where blood is coming from the body into the heart, and it is not oxygenated yet. That's why it's blue. So the main place it comes in is the vena cava. You have an inferior and superior vena cava, and then it goes through the atrium, right atrium, down to the right ventricle, and from the right ventricle it pumps up blood to the lungs. And that is where, so the job of the right ventricle is to pump deoxygenated blood to the lungs. Then once it comes into the lungs, it becomes oxygenated. It enters into the left atrium, and then there's a valve there and goes down to the left ventricle, and then the left ventricle's job is to pump oxygenated blood to the rest of the body. Hence, the left ventricle is much more important that it is functioned properly, because it is what supplies oxygen to the body, all your body organs and everything. So, blood vessels, we have arteries, we have veins, and we have capillaries. Arteries carry oxygenated blood away from the heart. The largest artery is the aorta. Veins carry deoxygenated blood back to the heart. The largest vein is the vena cava. Capillaries, arteries meet is where arteries and veins come together, and that's where CO2 is dropped off and switched out. Blood clots and fights pathogens and poisons. It transports oxygen. It helps remove carbon dioxide and controls our body pH. Blood is made up of solids and liquids, cells and plasma. Blood cells are the solid part, and it's 45%. And you can see right there at the bottom, that real thin line is your white blood cells, and the red is the 44%, which is the red blood cells. And then the plasma is the part on the top, that's 55%. So when blood comes out, it's all mixed up, but when it settles, the blood cells are going to settle to the bottom, and the plasma is going to stay on top. Red blood cells carry hemoglobin, which carries oxygen through blood cells. It is produced by the bone marrow. Iron found in the bone marrow and RBCs gives blood its red color. RBCs function for a short time, 120 days, and then they are filtered out by the liver and spleen. White blood cells are called leukocytes. They protect the body from bacteria and viruses. When bacteria and viruses invade, WBCs rush to the area and multiply rapidly. WBCs are produced by bone marrow, spleen, and the thymus. And there are different types of white blood cells. As you can see in monocyte, eosinophil, basophil, neutrophil, and lymphocytes. Those are all considered white blood cells, but different types. Platelets are thrombocytes, same thing. They cause the blood to clot, and they are also produced in the bone marrow. Changes in the circulatory system due to aging. The heart begins to pump less efficiently. Your blood vessels narrow. The blood vessels are less elastic, and the blood flow decreases. Disorders of the circulatory system, hypertension, which is high blood pressure of a consistent pressure over 140/90 or higher. The major cause would be hardening and narrowing of the blood vessels. Signs and symptoms not always obvious when somebody has high blood pressure. That's why you need to get it checked. You're at risk for a heart attack or stroke if uncontrolled, and kidney disease and blindness. So if you have high blood pressure, it's just important that you get it checked and keep it under control, or else you will have damage to your body organs. The treatment is medication, exercise, a low-fat and low-sodium diet. Myocardial infarction is the other name for a heart attack. All or part of the blood supply to an area of the heart muscle is blocked. The heart muscle dies due to lack of oxygen and nutrients. So basically on that, when you're having a heart attack, one of the coronary arteries gets blocked, and where that coronary artery is, there's no flow of oxygen to the heart muscle, and the heart muscle dies. Coronary artery disease, it's a buildup of plaque in the arteries of the heart. It causes damage to the coronary arteries. Myocardial ischemia is heart muscle does not get enough blood, therefore lacks oxygen, which may cause chest pain. Ischemia just means lack of oxygen, and if it's myocardia, then it's in the heart. Angina pectoris is the medical term for chest pain. So if you hear somebody having angina, that's chest pain. Congestive heart failure, CHF, is where the heart fails to pump effectively due to the damage of the heart muscle. It can be on the left side or it can be on the right side. Signs and symptoms, it will have swelling or edema, difficulty breathing when lying down, which is called orthopnea, and weight gain, because the body is not able to pump the fluids efficiently, so they build up in the body. Treatment is diet, medications, and some fluid restrictions. Peripheral vascular disease, or PVD, is a condition in which blood supply to legs, feet, arms, or hands is decreased due to poor circulation. Deep vein thrombosis is a thrombus. A thrombus is a blood clot that forms in a large vein. It's most often in the leg, and it's stationary. Thrombus does not move. And it becomes an embolus when it is a thrombus that breaks loose and is moving through the circulatory system. And when that's happened, that clot is traveling, and if it can lodge in the heart, it causes a heart attack or an MI. If it lodges in the lungs, it's called a pulmonary embolism, and if it lodges in the brain, it causes a CVA or a stroke, which all three of those can be fatal. Anti-embolic compression stockings, or TED-hose, they are used to increase blood circulation and prevent thrombus in the legs. They are measurements taken to make sure you have the correct size. They are best applied in the morning while feet are still elevated and before residents get out of bed. They have a seamed hole to allow assessment of the skin color. They can be either knee-high or thigh-high. So you may have an order for your resident to have on anti-embolic stockings or TED-hose, and it would be your job as a CNA to make sure those are on and off and when they're supposed to be. Blood clot prevention. This is a sequential compression device, or CSD. So those are just wrapped around the shin and thigh, or shin and calf there, and it blows up and goes back down and just keeps the circulation to the legs good while they're stuck in bed and can't get up and walk. They use this a lot right after surgery, and that is the main cause, is to prevent blood clots. And that is it on circulatory. We have another on vital signs.